India is becoming a much more prosperous country, and with growing prosperity, there's rising consumption of all kinds of things from luxury goods to vehicles. And Indians are using a lot more antibiotics. Between 2005 and 2009, sales of antibiotics in India have grown by 40%. Of course, there's a lot of bacterial infection in India, so there's a need for a lot of antibiotics, and India manufactures about 30% of the global supply of antibiotics. Antibiotics are widely available across India over the counter without a prescription. So there's rampant overuse, and there's also probably a lot of underuse. But with all of this use of antibiotics, there's a growing problem with bacteria that is resistant to antibiotics. Over 50% of infections in hospitals in India are resistant to commonly used antibiotics. At Sir Ganga Ram Hospital in New Delhi, one of the few hospitals in India that has a microbiology lab, scientists were able to track the emergence of a super resistant type of bacteria endowed with the so-called NDM1 gene. Now, this NDM1 gene allows bacteria to resist not just commonly used antibiotics, but even the last resort IV hospital antibiotics that are only used in hospital settings. These NDM1 bacteria have actually spread outside of South Asia to some 35 countries so far. And one way that that's happening is through medical tourism. At hospitals like Medanta Hospital outside New Delhi, some 15% of patients come from overseas. And they come from overseas because they can get the same surgeries with world-class, internationally trained physicians at 1/5 the price that it would be in the US or the UK. So a lot of patients are coming for surgeries to places like Medanta Hospital and elsewhere in India. They're picking up these NDM1 infections and they're bringing them to their home countries. The trouble is in India that the sanitation has still not risen to the level of development that's happening so rapidly in that country. So the exterior environment can come into these world-class hospitals, and hospital waste enters into the environment. And in fact, in recent years, NDM1 bacteria have already been found in New Delhi's drinking water and in puddles around the city. And this leaves people who live in slums highly exposed. 20% of New Delhi's population actually lives in slum areas, and these slums, have open sewers where wastewater from washing, from cooking, and from human excretion can expose a risk to the slum dwellers. A lot can be done with using antibiotics more rationally, and that's what people like Dr. Ramanan Lakshminarayan at the Public Health Foundation of India is trying to get hospitals to use antibiotics more selectively, more rationally, but how well India can control use of antibiotics in the community is still very much an open question. Many people who live in slums have a high burden of bacterial infections, but they can't necessarily afford full courses of antibiotics. Many doctors in slum areas prescribe just 2 or 3 doses of antibiotics because their patients can't afford a full course of 10 doses at a time. And this is another way in which antibiotic-resistant bacteria can emerge. Antibiotic-resistant bacteria, of course, is a worldwide problem, but in India, there are very few drugs in development to treat the kinds of bacteria that NDM1 plagues. These bacteria come from a class called gram-negative bacteria. They're morphologically much more resistant to antibiotics generally, and there's very, very few drugs in development to treat these infections, unlike drug-resistant bacteria that are common in Western settings. There are at least a few drugs in development. So this poses a serious risk for medicine generally and the people who are exposed to these bacterial infections. And doctors in India are very much worried that until new drugs are developed to treat these infections, that people may end up suffering what is essentially an unstoppable infection. Of course, that poses a huge risk for modern medicine, which relies on the ability to treat infection.